Going with our conversation, Dr. Dan Clark from the Indiana Regional Medical Center, brought to you by Marcus and Mack, a law firm representing injured people. When this all started, this pandemic stuff, we had you scheduled to come in that very next day, and obviously we didn't get you on that day, but we're so happy to be able to talk to you now. Give us an idea of what it's been like for you as a physician through all of this with the pandemic and the new procedures that have had to have been followed at IRMC.
Oh, it's been a new world out there. When none of us ever expected this to happen, and it took the whole world by surprise. And Indiana's no different than anywhere else. And I've changed a lot from being a surgeon to doing a lot of administrative things and helping plan for our response to this pandemic should we ever get overwhelmed. Unfortunately, that didn't happen.
Yeah, and that's the good news from it all. And maybe even some better news to share with you today is the fact that elective surgeries are again part of the options at the Indiana Regional Medical Center. So you get to put down the pen and maybe pick up a more appropriate tool for a surgeon. That must feel pretty good.
Yeah, it does feel good to get back operating again this week. I have to admit it. It's I missed it, and taking care of our patients, and we had to put a lot of patients off that needed things done, and so it's good to get back to patient care.
Let's talk about that. What is going on at IRMC? What are you able to do now that, say, last week or the week before you weren't able to do?
Well, as of last week, we weren't able to do any elective surgery, so the only people we were operating on who came in who had true emergencies or had rather urgent procedures that needed to be done. And the gauge that was put out by the national societies, the American College of Surgeons, and other governing bodies from all the different surgical specialties basically stated if something could be put off for 8 weeks or more without having a serious adverse effect on their health, then it should be put off. And so that's the guideline we kind of went by, and that even included breast cancers. There was a national COVID task force from the American Society of Breast Surgeons, the National Clinical Cancer Network, and several other societies that got together who do breast care, and basically came up with a grading system that early breast cancers could be treated with hormonal therapy and their surgery delayed, which, as you can imagine, is not the most pleasant idea for patients to have their surgery postponed.
Yeah, it must be quite distressing to the patient. Must not make you feel very comfortable as a breast surgeon either.
Right. It's something we would have never recommended, outside of this pandemic.
Yeah. Okay. So what types of procedures have you done this week? What are the types of things that we can look forward to in this week and the coming weeks?
Well, basically, we're open for full business at this point. When you look at the guidelines for when you should reopen, one of them is if you have less than 50 cases per 100,000 population. With Indiana County having an approximate population of 84,000, that would be 42 COVID cases in the last 14 days. Well, to be honest with you, we've never met that requirement. We've always been well below that. Mm-hmm. Like I said, we've been fortunate in Indiana County. We have not seen an onslaught of COVID cases. So we've met the criteria to reopen from day one, essentially. So we're fortunate in that area. So we are doing all surgeries now. And, fortunately, first people we called were all those patients who had their breast cancer surgeries postponed and got them back on the schedule. We're doing colon cancers, doing hernia surgeries again, basically. We're doing, all the orthopedic ranges. The things that we have to worry about is we're trying to avoid cases that would require a prolonged inpatient stay or a outpatient or inpatient rehab after discharge. We don't want patients in facilities for prolonged periods of time at this point. That's the only thing that we're looking at potentially keeping out of here for a little bit.
Would that include joint replacements or no?
Not all joints. A lot of joints with today's techniques that the orthopedic surgeons use, there's some people go home same day from joint replacements. And most patients, if you're in good health, spend a couple days in the hospital with some rehab here and then go home. So, but if you're frail or elderly and, might need inpatient rehab, such as a skilled nursing facility, we're keeping a close eye on them and whether or not they really need to be done. But like I say, even in our skilled nursing facilities around here, we've been fortunate, that we haven't seen a big rush of COVID patients even out in the population.
Couple of things, reports that have come out. One said, I think it was a week or so ago, that said that because it came, and this happened, of course, during colonoscopy or colon awareness month,
right.
People were missing out on their diagnostic testing, and we can understand why at that time, but it's time to think about that again, isn't it? You don't want polyps to develop into something that is going to be much worse.
Absolutely. And that's what we were going to talk about, is that, colon cancer is a preventable disease for most patients. And the way to prevent that is to get your screening done. So if there's any change in bowel habits, change in the color of the stool, we always talk about blood in the stool, but sometimes it's hard to tell that there's blood in the stool. It's basically a darker change to your stool that happens. You really need to get a colonoscopy. And those were all postponed with this. And now, the gastroenterologists and Dr. Bill and Dr. Guidetti are back up doing colonoscopies and doing the screening, and every reason you need a colonoscopy, they're up and running full force.
Yeah. Big report came out yesterday that said that they are finding a very much alarming rate of people who had chest pains that actually had heart attacks, people who had strokes as well, and didn't consider them serious enough that they had to go to the emergency room. We have to get rid of that kind of thinking too, right?
Right. We're all amazed. We've been saying, the ER has been ominously quiet for the last month or so. And we were saying, where did all the heart attacks go? Where did all the strokes go? Where did all the appendicitis and the infected gallbladders go? So I think people were just afraid to come in, and they were dealing with these things at home. And, we're worried that we're going to see much worse conditions coming in now that things are opening up because people have put things off.
Yeah, and that is exactly what the doctors in this article that came out yesterday were saying. It could be much worse for you if you put it off. And so now's the time to take care of it. When we heard our spot for the IRMC Nurses Appreciation Week a couple of minutes ago, one of the nurses said that right now the safest place for you to be is the Indiana Regional Medical Center. Really have gone maybe a little bit overboard, some might consider, in making sure that the place is clean, it's disinfected, and it is as safe as it possibly can be.
Oh, absolutely. I mean, we joke about that. It's safer to be in here than to be out in the stores, because every one of our employees is screened on admission to the hospital. We come in, you have to take your temperature. If you have any symptoms or anything like that, you don't go to work, and so the hospital's been very diligent about that. So, and everybody wears a mask, around the hospital. Mm-hmm. And patients and visitors can't come in right now without a mask. We've got a pretty strict visitor policy right now going on, to stop having people just wandering around the hospital and increasing the risk of spread. So the hospital and the administration and everybody's done a real good job. And I do actually feel safer at work than I do out in the community right now.
Telemedicine has become really, really big. I assume it's that case with you as well. You can do some follow-up with folks through telemedicine now that maybe they might not have thought of that in previous times.
Right. I never would have thought of it either, and we're all doing it. And, I still wanted to see my first post-op visit in person so I could check the incisions, and things like that. Mm-hmm. But then after that, the more long-term follow-ups, most of them we can do over the phone. The downside is you can't really do a physical exam. But we can talk to patients and see how they're doing with their symptoms and everything, and we can make interventions, by doing this with telemedicine. It's been a great boon by not just shutting everything down and keeping in touch with patients.
We're talking with Dr. Dan Clark. So folks need to know that now is the time to get back on the schedule for whatever that surgical concern might have been, for whatever the health screening concerns might have been. Just because it came in the middle of colon cancer awareness month doesn't mean that you can forget about colon cancer as a possibility or any of the other diagnostic tests that folks might normally take.
Right. And the other thing I want to let patients know, we're being very conservative about who we operate on too. And 100% of our elective surgery cases are getting screened for the virus. And that's one of the recommendations. There were guidelines that were published for reopening elective surgery, and the state, basically said that hospitals could reopen the elective surgery if they followed these guidelines. Not everybody's following them to the same degree. We're pretty much following them to the letter of the law here. Mm-hmm. And we had a big committee that got together to go over all this and make sure we're safe for reopening. And this was by multiple organizations. The American College of Surgeons, which is the leading surgical organization in the country, the American Association of Anesthesiologists, the group of perioperative nurses, and the American Hospital Association all got together. And that's kind of unique in and of itself. You usually don't have those four groups sitting down and getting together. But they tried to think of everything possible to make things safe for patients coming back to elective surgery. And we followed all those. It's a 4-page document. You have to cross all the T's and dot all the I's. And one of those is doing, it was recommended, not stated they had to, but recommended that we do pre-op testing on patients for COVID-19. So that's because 30% of people walking around who have the virus will have no symptoms or won't develop symptoms for 10 to 14 days. So you don't know if you have the virus right now or not. And so we're testing our pre-op patients. And, it's been fortunate that we've been working with IUP, and one of the labs at IUP has developed a way that we can now do it locally. And so we used to have to send it out to Mayo and Quest, and, we'd be up to a week turnaround at our peak. And, and even right before we got it in-house, it was taking 4 or 5 days to get the results back. Now we have them back in less than 24 hours because of this unique arrangement we have with IUP. It's been great working with the university to develop this. And it just shows how the community pulls together in these times. Wow. And, it's been wonderful. Now we can get your testing back in less than 24 hours.
So somebody sitting at home right now that has been putting it off and needs to get back on the schedule, what should they do? What should their first step be?
First step is call your doctor. Call the office and get in, say, hey, my appointment's been put off. We kept a list in our offices, and we're trying to contact those patients and bring them back in on a priority basis. Of course, our first priority here with any cancers that have been delayed. And then, very symptomatic patients or patients that we're worried about, that gallbladder might turn into an emergency case. And so we're contacting people. But if you haven't heard from us, and if we've missed somebody, you should call the doctor's office and say, hey, I'm ready to go. What do I need to do? And, typically if they'll either have to bring you back in for a reappointment if it's been over a month or so, or they'll get all those labs and everything ready, and they'll get you an appointment to have the COVID-19 testing. We're doing it within 5 days of surgery so that we get adequate turnaround. We have the weekend in there we have to consider. But we don't want it to be too long ahead of time so that you risk re-exposure, and then that test may not be accurate.
Yeah.
So, but just call the doctor's office, and we'll get you in and get things rescheduled.
Very good, very good. Hey, good to hear from you again. We'll catch up again very soon, I'm sure.
Sounds good, Todd. Good to talk with you.
Have a great day.
You too. Take care.
Dr. Dan Clark from the Indiana Regional Medical Center. Now's the time. Get back on the schedule. Get it taken care of. Get it taken care of.